Time now for your COVID-19 questions. With me tonight, infectious diseases specialist Dr. Chang. Thank you for being with us. Let's get right to it. This one is interesting. We see people do this all the time. Is it safe to pull down my mask and leave it under my chin when I don't need to use it?
So no, that is probably the worst thing you can do with the mask, because that outside of the mask is where all the bacteria and the viruses get caught from other people. If you're leaving it dangling on your chin, they're basically going to contaminate your chin and the lower lip, which means that you're putting all that stuff basically in your mouth and defeating the whole purpose of wearing a mask. So you take a mask off, take it by the ear loops, put it away, wash your hands, but don't let it dangle by your chin.
Excellent. Okay, what do we know about how many COVID-19 patients get severely sick compared to those with only mild symptoms?
So from the Canadian experience, there's been about 115,000 cases. About 10% of them have required hospitalization. About 2.5% of them have required an intensive care stay. And about 8% of them have died. Now, it's important that the testing numbers don't necessarily reflect everyone. At the beginning, we didn't test everyone necessarily with the milder cases, so those percentages are probably a bit lower. If you look at the numbers, including some of the serology studies, the fatality rate is somewhere between 0.1 and 2%, depending on the population you take a look at.
Okay, so this one is interesting. It's a time when people are trying to travel. Should people self-isolate as a precaution after traveling to and from other provinces?
So it's important from the provinces that have higher COVID incidence, Ontario, Alberta, British Columbia, and Quebec. If you're going to areas with lower prevalences, so Saskatchewan, the Maritimes, Manitoba, the territories, then yes, that isolation for 14 days is important because you could be seeding those communities that haven't seen a lot of transmission. But if you're going between Ontario, Quebec, Alberta, and British Columbia themselves, then your risk where you are versus the risk where you visit is about the same. So it's not that important to isolate in that setting.
Okay, great to see you, Dr. Chagla. Thanks very much.
No problem. All the best.